the ECIST podcast series. My name is Ashraf Osman, and I'm an improvement manager with the Emergency Care Improvement Support Team. This afternoon, I'm delighted to be joined by Geraldine, Debbie, and Emma, and they will talk about the conditioning games, the deconditioning games in the East of England. Geraldine, Debbie, and Emma, can you please introduce yourselves? Let's just start with Geraldine.
Oh, thank you, Ashraf. We're so delighted to be here. My name is Geraldine Rogers. I'm the Director of Nursing for Leadership and Quality here at the East of England, and I'm also a Nurse Fellow for older people. I'm going to hand you over to Debbie now.
Hello, thank you. I'm Debbie Whittaker. I am the Regional Lead for Discharge and Quality with NHS England and Improvement at the regional team in the East of England. Emma.
Thank you for having me here today. So my name is Emma Brown and I'm a physiotherapist and a regional clinical fellow working in the East of England with NHS England.
Okay, so Geraldine, can you tell us more about the deconditioning games? What was the vision behind them?
Well, Ashraf, we were very fortunate that we get to meet with Helen Bennett and Dr. Ahmet on a regular basis, myself and Debbie. It all started, and we found we always call it our bubble of happiness, because we go into this virtual space with Ahmet and Helen, and we discuss all kind of things of what could be the art of the possible and what is the concerns and issues, particularly for older people in hospital. As part of that conversation, we started exploring what could be possible to look at deconditioning in hospitals, in care homes, in the community. And suddenly we came up with the brainwave. We thought, well, actually, what if we could have a games for the East of England region? And suddenly we thought about whether we could call it the Winter Olympics, etc., of what we might need it to do. And we set about of what would be our objectives, what would be the outcomes, and what really could be possible of us doing something on this stage at this size, because it's brilliant having a great idea, but then putting that great idea into fruition is a whole totally different meaning altogether. And so we started to think, actually, what could this look like? Then how could we tie it into outcomes? How could we tie this into discharge? How could we tie it into patient experience? And I think one of the interesting things, we were very conscious in terms of workforce fatigue, workforce sadness that people have had over the last 2 years, and how could we bring a lot of joy into the workplace again by doing different things, different initiatives that would improve patient outcomes, but also would bring about a lot of job satisfaction in the workplace. So when you tie up all those things together, that's when suddenly our objectives and our ambition became alive. And we thought, actually, you know what, we can do a lot. Because when you look at deconditioning in earnest, once sometimes patients go into hospital or don't move or they're not been well, there was some places that we recorded that people had done 12 steps in one day, which wasn't very much at all. And suddenly they start to decondition, suddenly wastage of muscles occurs in a very short space of time. And then people don't go back to where they were before. And we start losing muscle loss, from the age of 25, if we haven't done anything about it. And so therefore, by looking at it through different lenses, we start to look at the games in earnest and see what we can do. And, in terms of, it was a great piece of work, Debbie, wasn't it, when we kind of all came to there? It's the joy we brought and kind of having that conversation was good, wasn't it?
It was very exciting. And I think Geraldine talked about the art of the possible. And I think, that was the springboard about, what is it that we can achieve and how do we support people to do that during one of the most challenging winters that was approaching.
So Debbie, how did you go about setting the games up then?
So we had We wanted to start a social movement. We thought big, you know, this was at the beginning of this conversation, it was huge. And like Geraldine said, it was a very happy, exciting meeting that we had to discuss these plans and the opportunity. So we invited stakeholders from around the region, and those stakeholders worked in all of our different providers across the region and represented all different professional groups. And we very much used those stakeholders to help shape the games. And they, like us, and including public health, and they, like us, initially, the first couple of meetings, it was very energised meeting and we had big ideas, but we very soon realised that we needed to scale this back and focus on what was achievable, and how could we bring about fun, because that was how this whole conversation started, and have impact over the coming months. So together with those stakeholders, we very much narrowed down the objectives to raising awareness. So this was about how do we raise awareness for people across our region of the impact of deconditioning, and how do we pull out all of those amazing practices that have developed over the last few years in preventing deconditioning. How do we energise teams that have started some work, but because of the pandemic have found that difficult to continue? And how do we encourage people to test new ways of working from our teams, the multi-professional teams at all levels within the organisations? And very early on, we recognised the need that we needed to support staff. So we had a focus on staff wellbeing as part of the games as well, because we very much wanted to have that ethos of we have to look after ourselves so that we can care for others. So that was the starting point. We had we sent out a hold the date flyer for a launch event. We decided to launch the games during Falls Week, which was in September in 2021. And we were really lucky to have Brian Dolan, who was the founder of NPJ Paralysis and Last 1,000 Days, and he was our keynote speaker. And we had Dr. Amit Arora, who he provided some amazing insights and energised the teams who joined. And we had Mr. Motivator. So building on that whole premise of we have to look after ourselves to look after others, he did an exercise session for everybody who joined, and very much shared some of the key messages around the games. And then we had an example of best practice from Colchester Hospital that was showcased at that launch event, as well as identifying with or signposting everybody to how they got involved. We developed a booklet, an easy guide that had all of the information in an application form, a medal submission form, and all the details about the medals. And then we had, like all good games, we had a games torch. So at the launch event, the game torch was lit, and then we spent the next 6 weeks travelling around the region, raising awareness, building the momentum, and the excitement. And teams had their photos taken with the games torch. They got to the opportunity to ask questions and share their ideas for getting involved. And it really started to build that momentum. And we launched a Twitter handle at GamesEOE, so we could start using the social media platform to really showcase everybody's involvement from that time. And Emma, you joined me on some of those visits, didn't you? They were fantastic.
They were absolutely brilliant, and it was great to actually meet with people directly and hear their stories as well. And as you say, it really helped to increase the profile of the games, and taking pictures and sharing that on social media, on the Twitter account as well.
Yeah, you could really see the movement take place, couldn't you? Sorry, Ashraf. You could really see the movement take place. It was really interesting because people really wanted to do this, and you could see, even though people had been very fatigued and we were going into winter, and And as with this winter and the last 2 years, you're holding your breath, aren't you, as when we're diving in? But you could see actually people were really looking forward to doing this, and that we were really starting that movement. And we were fortunate, weren't we, as well, that we got loads of people on the Trailblaze with us. So we had links with one of the CCGs who spoke to the Paralympian Danny Crates, who did a fabulous video for us, saying, you know what, get moving, do this, we're off. And we couldn't believe how fortunate we were that we had his voice starting off the games with us in that first week. It was amazing, wasn't it?
Absolutely. And it was something really positive, wasn't it, to focus on at a really, really challenging time. And I think people felt really passionately about the cause and about the movement and about the importance of getting people moving. And so, yeah, I think it was a great focus to have at a really challenging time.
I think sometimes in situations where the pandemic went through, people can forget the basics of getting people out, like you say, you know, pajama paralysis and things like that. So, Emma, in your view, what were the main benefits for patients?
There were many, and I think what was really exciting to see was the uptake in so many different settings. So we had acute hospitals participating, we had absolutely amazing care homes, and once again, care homes had such a challenging time and a negative press at times as well. And this was a time for them to really shine and really get their residents involved. And you could really see the positive impact that had on both the residents, but also the well-being of the staff within the care homes. And, you know, we had such good, if you like, stories and news about people on acute wards, that more people were getting up and dressed, ready for lunch. People were beginning to walk again to the bathroom rather than being pushed in a wheelchair. And it was these changes that really have a significant impact on people's psychological well-being, physical well-being, and also the impact that will have on them, for example, being able to leave hospital sooner, get back home, and really valuing their time in whatever setting they were in. So once again, it was just such a positive thing to focus on. And also the staff well-being. I think people began to really appreciate, you know, how important it was to look after staff. And once you know, you saw those benefits, it was great to see that.
Nah, that's really good. Debbie, you said something about medals. Could you explain a bit more about that? Because I'm, you know, really interested in that.
So I think so. The one of the fundamental aims of this campaign was to make it as simple as possible for people to get involved. So there was no big poster presentation or driver diagrams or PDSAs that needed to be submitted. This was about people submitting a summary, a brief summary of what they were doing and the difference it was making to people in their care. And so we had 4 medal categories. The first one was very much tailored around people making a difference to those in their care. So it gave the opportunity for those projects to be individualised, to really focus on what mattered most to people in that environment, and for staff at all levels, all grades, to come up with ideas, to be creative and have the support and the confidence to test those in practice. The second category was very much around supporting people to keep moving. So we provided goal setting templates. We provided a SPC chart. So all people had to do was to plot the dots each day. And there was 2 categories. One was to support people to be up and dressed in time for lunch. So really focusing on that need to normalise that getting up and having meals, whichever care setting people were in. And the second one was to set activity goals that were individualised to patients, residents and service users, and for staff to make that as meaningful as possible. And what we saw was that within those, you know, that it sounds very narrow, those categories, but people were so creative in what they did with those medal categories. And even those getting people up and dressed and out for lunch, there was some elderly care wards who had the beds that they had in their environment had the ability to be moved into a seating position. So patients, even if they didn't have seating balance or the ability to sit out of bed, they were still sat up in time for lunch. So it was really fantastic to see. The third category was around using data to inform improvements, and this was aimed at really highlighting all of the discharge data and length of stay data, and making it much more available to staff so that they could actually focus on using that data to inform some of their improvement work. And we saw some amazing projects, and a frailty unit, for example, they have changed the whole process as an MDT of how they support their frail patients with a specific aim of reducing their length of stay of those patients who normally stayed in hospital for 1 day to 0. So they've really embraced that and used that to make a difference. And the final one was about supporting staff wellbeing and supporting staff to be active, keep active. And that just brought so much joy and so much healthy competition as well. It was brilliant to see. And then each month we invited people to submit their medals, and we had a medal committee, which I know, Ashraf, you've joined us on, and they were such a pleasure to be involved in. We had so many medal submissions every month that we couldn't go through them all at the committee, so we would bring a sample of them. But the most medals that we awarded in a month was 149, and so that is 149 different projects making a difference to people across all health settings, which I think is absolutely amazing.
And in the middle of winter as well, Debbie, you know, when you think about it, you're just thinking, we couldn't believe of that month, could we, in terms of you thinking, even with everything going on and what the crisis was in the system at that time, that actually, it just demonstrated in terms of how serious people were taking this, but also how much joy they were getting from it as well. And ironically, even during that time, they said to us, can you extend the games, because we had some plans for this month that we couldn't do because COVID had kind of restricted them somewhat, and could we extend the games for another month? And we willingly said yes, because we thought this is fantastic news, because we enjoy seeing the amazing work coming in, so we get a lot of joy from it as well, and seeing the improvements that has been made in this platform. So it was really good to see, wasn't it?
It was. And I think we had 3 different categories of medals. So the bronze medals reflects the number of new projects that were starting, and even every month there are new projects that are starting still, which I think is fantastic. The silver medals, those teams were able to demonstrate, they were able to provide evidence that they were making a difference. But we've had an increase in number of gold medal winners. We had 10 in February, and we're still to see how many we've got in March. But those teams have been able to demonstrate that they have embedded sustainable changes in practice, and a lot of those are also spreading their improvement work to other areas and other organisations, and we are taking some of those initiatives and supporting and rolling them out as best practice examples in the summer. So very exciting.
That's really great. I think calling it a phenomenal success is the right actually adjective to put to it. Debbie, in terms of, you mentioned about providing a template for improvement and things like that. If an organization like a care home or nursing home or another organization wanted to do this now that the games are coming to an end, would they be able to access those templates?
Yeah, so all of the resources that we have, there are loads of resources that we've made available to teams, because we very much, this had to be as simple as possible for people to get involved. So they are all on the Futures platform. under the winter deconditioning games in the Home First section pages. But if anybody wants to access them and has problems, you can email us at england.deconditioning.games@nhs.net.
Fantastic. In terms of just the interest up and down the country for this, I have the fortunate, I'm fortunate enough to work across two regions, East of England and Midlands, and people in the Midlands ask me about what is the deconditioning games, why can't we have them here? What are your top tips if another region or another area or wanted to start this, or are there any plans to make this national?
Bring it on, I say.
Yeah.
We'd like to open this up and make it a national event next winter. So if you're interested, get in touch.
Yeah, absolutely. I think it would be amazing, wouldn't it, to have a whole country games where each region could be in terms of compete against each other, but for all the right reasons. So this is a competition where the outcomes are good and everyone is winners in terms of medals, participation, in terms of outcomes, in terms of achieving that joy at work. So yeah, bring it on, as Debbie and Emma said. We're very game on. So I think, and I think based from our experience, it's not a walk in the park. It's a lot of hard work, but I think the energy and that we get from doing it all and the joy we've got from doing it, I think has made every hour of that we've done it very worthwhile. We've seen the projects that come in and the pictures, there's some things just never, I'll always remember that ones that the pictures came in and the patients were in their, it was in a care home and the patients were in colourful sweatbands and cards, and that they were, you could see the joy on the patients' faces. They were so happy to be doing things and been involved in something different. And I think as it gave people permission to be creative. And I think that's what has the games has given as well, because we don't always get to be in that space to be creative. We're always in that reactive crisis cycle. But by doing this, ironically, by being creative, you're more proactive. But by being proactive, you hopefully will prevent the crisis in the first place. So I think that's what we would hope to do. So yeah, we're game on for the competition. So yes, please.
Fantastic. It's really good that, this is like the truest form of strength-based working, using patient strength, but also, improving the quality of their life and their health, and also the quality and well-being of our staff, because they actually enjoy doing it and it's worthwhile doing it. And the results are very, very visible. The only thing now that remains is for me to thank the three of you. Thank you, Debbie, Emma, and Geraldine, for coming and participating in this absolutely amazing games that you've created in the East of England.